Hi, I'm Liz Hillen, prosthetist orthotist with SPS. Welcome to the Clinical Minute. In this session, I am joined by Jak Kesselring, who is the Director of Clinical Education and prosthetist orthotist from Thuasne, USA, also formerly known as Townsend Designs. Welcome, Jak.
Thanks, Liz, for having me. I'm excited to talk about everything today.
Great. In this session, we're going to discuss the patient selection guide for the Thuasne USA SpryStep AFO series. All right, Jak, let's go through the patient selection guide here. You have a variety of different AFOs in the SpryStep series. Let's start from the beginning. Based on how a patient's presenting, how is a clinician deciding which device is most appropriate for their patient?
Yeah, that's a great question. And, we've talked about the SpryStep series overall before, but we designed this prescription guide, which is up on screen, so that it makes it a little bit easier for clinicians to go through the indications for each one of the AFOs. So as we look at the top of the prescription guide, the first question we ask is there a need for triplanar control? And if the answer is yes, then we start looking at more of those custom solutions to control the hindfoot, midfoot, and forefoot. If the answer is no to triplanar control, then we start looking at what motions and manual muscle testing we want and see in the patient presentation. The next question is, how do you best describe any knee instability in the patient? And then from there, we branch down into knee flexion instability or knee hyperextension instability. And we look at the patient activity level from low to high and the patient manual muscle testing from low to high as well. And then we start diversifying into each one of the four AFOs that are on this page.
Great. And so a patient who is presenting with more of a hyperextension knee versus excessive knee flexion and terminal stance, what device would be most appropriate for a patient?
Yeah, so when we look at knee hyperextension, if we look at mild or moderate level of deficit, then we'd be looking at the flex or the original.
Okay.
If we're looking at knee flexion instability, same thing, mild or moderate level of deficit, we'd be looking at the plus or the max. My recommendation is, if you're able to, take the original and try it on the patient, watch them walk, see how their gait biomechanics are impacted by the SpryStep original, and then you can go up or down based on the rigidity or flexibility you need from there.
Exactly. So flexible deformity, these patients can adapt with more of an off-the-shelf option versus a rigid deformity going more custom, correct?
Correct. And the one thing to keep in mind as a clinician is just, on off-the-shelf AFOs, there's no molded inner boot or anything like that. So with some of those rigid and flexible deformities, then looking at more of a custom with the molded inner boot or a way to accommodate that triplanar control is where we would, go back to our first question on this list and look at our custom solutions.
Well, thank you, Jak. Thank you for explaining the patient selection guide for the Thuasne USA SpryStep Ankle Foot Orthosis series. If you would like a copy of this patient selection guide, or you would just like more information about the Thuasne USA SpryStep AFO series, go to spsco.com or call your SPS sales manager today. This has been the Clinical Minute. Thank you for watching.